Hello, my name is Natalia Riccieri and I am presenting on management of asthma in athletes. Asthma can be triggered by many stimuli, including allergens such as pollen. Other irritations are respiratory infections, aspirin or inhaled irritants such as cigarette smoke. One, all athletes are required to have a screening evaluation, which is a history of any presence of asthma. This is done before the athlete can participate in any sport. Some additional screening can be done if asthma symptoms occur. 2. Athletic trainers should be aware of the signs and symptoms such as tightness in chest and breathing difficulties. 3. If more of the symptoms are presented, then additional screening questions will be asked. 4. Pulmonary function testing should be included if the severity of asthma increases. These guidelines help athletic trainers be more prepared in case of an emergency. 1. Athletic trainers should implement a specific emergency plan for an athlete who has asthma in case it becomes a life-threatening situation. 2. Athletes who are experiencing any kind of respiratory distress should be referred rapidly to their personal physician. 3. Certified athletic trainers should have an extra rescue inhaler for each athlete during emergencies. 4. Athletic trainers and coaches should consider providing alternative practice sites for athletes with asthma triggered by airborne allergens when practical. And 5. Athletes with asthma should always have a follow-up exam to provide the best therapy. Pharmacologic means to treat asthma with medication, and non-pharmacologic is to treat without medication. Athletic trainers are more concerned with short-term asthma control. This means to treat athletes with exercise-induced asthma, or EIA. To treat short-term EIA, an athlete has an inhaler that is taken 10 to 15 minutes before practice. However, if an athlete is using it more than 3 to 4 times per day, the athlete must be referred to a doctor. If an athlete has any type of allergic reaction to their inhaler, another one should be provided. Treating non-pharmacologic, which is without medication, athletic trainers should know how to treat and control an athlete with asthma. A proper warm-up that is longer than 2 hours will decrease the reliance on medication by some athletes with asthma. It is important to have follow-up evaluation and everyday management and control of asthma. One, certified athletic trainers will know how to better diagnose and characterize an athlete who may have exercise-induced asthma. 2. They will know how to provide guidelines for a referral for an athlete who has or is suspected with asthma to receive the best care. 3. They will create an emergency action plan in case an athlete shows life-threatening symptoms of asthma. And 4. certified athletic trainers will be better educated on the difference between pharmacologic and non-pharmacologic treatments.